Hello, my name is Emma Laux, and this is my Older Adult Health Promotion Project. Table of Contents. Section 1, Assessment and Introduction. Section 2, Nursing Diagnosis and Introduction. Section 3, Teaching Plan or Intervention for Nursing Diagnosis. Section 4, Evaluation. Today, I will be looking into how nurses deliver health or wellness education in the elderly population. With older adults, it is essential we adapt our assessment tools and ways of collecting this data to match the needs of every older client. My goal for this client is to improve overall quality of life and manage dementia, particularly as it relates to his type 2 diabetes diagnosis. My patient for this project was a 78-year-old white male who has a current medical history of dementia, type 2 diabetes, and hypertension. My priority teaching needs for this client is how to live with dementia and diabetes management as it relates to dementia. The Healthy People 2030 topic that related to this is focusing on improving quality of life and care for people living with dementia. Later on in this presentation, I will discuss my full teaching plan and nursing diagnosis for this client. The nursing diagnosis I came up with was confusion related to Alzheimer's, as evidenced by impaired short-term memory, changes in sleep-wake cycle, hypoactive psychomotor behavior, and a low mini-cog score. The mini-cog has several tests to indicate a positive or negative screening for dementia. A score 0 through 2 is a positive screen for dementia, while a score 3 through 5 is a negative screen for dementia. The administration of the mini-cog is broken into 3 steps. Step 1 is to give the patient 3 unrelated words and ask them to repeat them. Step 2, the patient must draw the face of a clock on a sheet of paper, putting the numbers in the correct place on the clock. Then give them a time to draw the hands of the clock on. Step 3 is to ask the patient to repeat the 3 words that were given at the beginning of the exercise. Since my patient scored a 2, he is screened positive for dementia. This diagnosis is important to my client because dementia affects all aspects of life and health. Impaired short-term memory can lead to accidents and medication administration or insulin administration, especially with his type 2 diabetes diagnosis. Next, I will talk about the outcomes. My short-term outcome identified for my patient was the patient will review prescribed medications with student RN by the end of the visit today. I will evaluate this by documenting what medications the patient knows and does not know, and I will focus on medication reconciliation on those not fully understood. My long-term outcome, the patient's mini-cog score will go from a 2 to a 3 in 2 months. The student RN will perform a mini-cog screen once a month to monitor for changes. I will also suggest that monthly screenings continue with the care team. For my teaching plan, I really wanted to focus in on managing type 2 diabetes with dementia. First off, I would want to educate my client on issues for people with previous type 2 diabetes who develop dementia. These issues include forgetting to take medications regularly, forgetting that they have taken medication so at risk of double dosing, forgetting how to do injections, unable to make decisions about interpreting blood glucose results, such as adjusting insulin dosage or treating hypoglycemia, missing meals and drinks so at risk of low glucose and levels of dehydration, forgetting they have eaten and are at risk of high glucose levels if they eat again. My support plan goes as following. I will want to focus on safety. Since my patient is living in an assisted care facility, I know that they will have someone to look after them. The nurses there help him check his blood sugars and administer medications. They also make sure he has had enough to eat and drink for the day and that he is making healthy choices. I think this is the biggest part of my plan, since safety is our number one concern. We have already assessed his cognitive ability with the mini-COG score. Therefore, I think it is safer for the nurses at the care facility to administer his medications when needed, rather than him having all control. The nurses also will need to get to know him to assess his personality. This will help them understand both his diabetes and dementia, whether he's feeling bad or just confused. It will be important for them to understand his baseline. Lastly, in my support plan is the environmental piece. My patient should eat in a distraction-free zone and also take his medications without any distractions. It is important for people with dementia to focus on one thing at a time. Even though my patient only got a high school education and is of low socioeconomic status, I believe these factors do not matter in regards to teaching, in this case, due to his dementia diagnosis. My short-term outcome was met. My patient was able to review prescribed medications with me by the end of my visit. He did a pretty good job, but on the one he did not fully understand, we did some medication reconciliation, and by the end, he was able to recite what he needed to know. As for the long-term outcome, I can give the family or care team a copy of the mini-COG score and instruct them on how to test my patient each month. I can also explain how the scoring works and let them know to notify his provider with any changes. It is a pretty straightforward assessment tool, so I don't think this should be an issue. For my nursing outcomes, primary prevention for this patient would be education that is provided by myself, proper diet and exercise, and taking medications as prescribed. Secondary prevention can be the mini-COG screening assessment tool. And tertiary prevention can be seeking medical attention if cognitive decline is noted or for any other medical decline. I believe I had a pretty effective teaching plan. However, my limitations were due to the fact that my client had dementia. My teaching may have worked for an hour or so, but after that, he may have completely forgotten what I have taught him. This is why reiteration is so important. If I could revise my teaching plan, maybe I could have let the patient have more hands-on. For my teaching plan, I really included the care team. and not so much the client, because I was worried the client would end up forgetting what I have taught. Wrapping up, I really enjoyed this project. However, working with dementia patients can be very sad, frustrating, or disheartening. Sometimes all of your hard work can be so easily forgotten. And with teaching, it takes a lot of repetition for the patient to fully understand. I had to go very slow, and it was very time consuming and sometimes frustrating when my client wouldn't be able to fully comprehend what I was saying or even remember what I was saying 5-10 minutes later. However, I really loved the education portion and my role as a nurse teacher. As nursing students, I feel like we do not get to teach our patients enough. Even though we are learning so much useful information from this project, I definitely have learned a lot of patience and how to adjust my assessment to the geriatric population. Most of it is really slowing down and taking the time to talk to them. I realized old people love to talk, especially when assessing them. I think this project also taught me how to slow down in life and how to really focus on the details and enjoy getting to know each patient, which sometimes is hard on a floor where you have too many patients to take time with each one and really get to know them. I really enjoyed seeing this side of nursing.